Good afternoon, everyone. I'm Edina Chirwa, Mrs. Presenting from Zambia. I'm a student in clinical psychology, PhD. My study is on how socioeconomic inequalities affect common mental disorders. This is a systematic review. So the purpose of this systematic review was to consider the means of operationalizing and assessing the effects of social economic status on mental health. There's enough study to show that there's a link between social condition and general medical conditions. Disease risk at the individual level should be studied in the context of a wider socioeconomic conditions that leaves individuals to health compromising conditions. Health in this case is hypothesized as a consequence of access to social as well as material resources. This study sought to illuminate on the methodological and contextual issues which might clarify on the variability of the results related to socioeconomic status and mental disorder relationship. This came from the background of this study is from the fact that socioeconomic status is generally associated with high medical impairment and poor access to medical care in general. And in countries where epidemiological studies have been conducted and compared, the groups in the lowest level of education had a higher prevalence of mental disorders. Then lower socioeconomic groups have higher risk factors such as poor coping styles, stress exposure, ongoing life events, and weaker social support. In cases where both high and low socioeconomic groups suffered mental illness, it has been observed that even if they have the same severity level, the persons from lower socioeconomic groups tend to suffer more impairment from the same disease and have poorer prognosis. And where the government does not provide sufficient social welfare, like in most third world countries, lower socioeconomic groups tend to have lower access to healthcare in general, and even much less access to mental health care. Looking at the methods, a systematic review was used in the analysis. The search procedure used keywords and search for particular authors through the internet. So the common words there were mental health disorder, depression, anxiety, education, income, deprivation, socioeconomic status, social demographic, social correlations, socioeconomic, social class, psychiatric, psychopathology, and mental disorder. The method encompassed correlational studies, socioeconomic studies, and other psychopathological studies. Studies addressing common mental illnesses. There was a mixture of depression, mood disorders, and anxieties. These were the ones that were included. Three selection criteria were employed. These were date, setting, and population. Studies published after the studies that were included were published after 1980 and were conducted in the community rather than in hospitals, and were considering adults. in this case where adults include at the time of assessment, the participants should have been 15, even if they were followed before the age of 15, but at the time of assessment, they should have been 15 years old. Now let's look at the number of some of the articles that were employed to do this assessment. Excuse me. To start with, different studies employ different methods of studying this relationship. Some studies looked at correlation only. Others looked at the causal relationship, and there were some others looked at used diagnosis for the common mental disorders. Others used rating scales rather than diagnosis. So looking at a study like Kessler's study in 1994, excuse me, excuse me, the findings showed that socioeconomic status is mostly associated to anxiety than depression in the general population between, and this employed participants between the age of 15 and 54. Ariel, in the case of Ariel's study, the study sought to examine the association between socio-economic support, physical and mental health among inmates, and the probability that housing stability mediates this relationship among inmates living with HIV. The study found that there is actually a relationship between social support with physical and mental health. Then only homelessness was seen to have a relationship with low mental health rather than physical health. Then Stuart Brown and his colleagues in 2015 did a study where the socioeconomic correlations of mental well-being matched with those of mental disorder. This study found something actually interesting, that found something interesting in that the factors that contribute to mental social well-being were not necessarily the same factors that affect mental disorder. Then Hudson in 2005 also conducted a study to study the hypothesis about the causal structure of the correlation between socio-economic status and mental disorder. This is so because most studies previously focused on the correlation rather than the causal relationship. So Hudson's focus was on the causal relationship of socioeconomic status and mental disorder, and he found that actually there were both a direct impact on levels of mental disorder and also indirect through stress. Socioeconomic status itself affected mental disorder, but because of lower social economic status, people experience higher stress, and that stress also affected mental disorder. Then in the case of Argo and his colleagues in Ejabo in 2002, in attempting to estimate the risk of suicide among youth related to family as well as individual psychiatric and economic status, meaning that this study was looking at the background of these youths in terms of their socioeconomic status and their history of psychiatric disorders in the family, as well as the socioeconomic status of the individual youths and they also their mental disorder history as well. This study found that parental factors related to an increased risk in suicide in youth, where hospitalization for a mental disorder, unemployment, low income, low level of education, divorce, mental disorder in siblings, and low level of education among the youths. So, meaning that both the individual's background as well as the parental background were found to be factors that influenced mental disorder of these particular youths. Then Welch and Lewis in 1998 investigated whether poverty and unemployment increased the probability of delayed recovery from common mental disorder. So the focus was on study participants who had already experienced common mental disorder and seeing how the probability of them getting well being affected by socio-economic status. Firstly, they found that the association with low mental disorder, the
Ms.
association
Edina?
with low. Yes.
Hello, Ms. Edina. You have another 3 more minutes left. That's it.
Okay.
Hello?
Well,
Okay?
yes, I can
That's
hear.
fine. Okay.
Okay, I can hear you. All right. Well, in general, when we look at all these studies that have been presented, there were inconsistent results. Other studies showed that when other factors like history of mental illness was adjusted for, family history or individual history, they found that some studies found that the risk factors from socioeconomic status were reduced. And there's also an argument by other studies that maybe it's actually the mental disorder that causes low socioeconomic status. So there seems to be inconsistent results in these places where there have been studies among women in different countries, in different states, and different studies kind of found different results. So this implies that this is a field which there's room for further study. In conclusion, I would say there's room for further study. The majority of studies, yes, did find that inequalities in common mental disorders did influence. Inequalities in socioeconomic status did affect the common mental disorders, favoring people from higher socioeconomic status. This implies that there's room for further study. Two, this is something that the governments in different countries can use to plan to question people from lower socioeconomic status, because they are at a higher risk of common mental disorders, especially anxiety-related disorders, but as well as others. Sorry. One strategy would be to emphasize on reducing the duration, chronicity of these mental disorders in people from low socioeconomic status. And there's also need for further studies in African countries, or generally developing countries, and my focus would be Zambia, the country that I'm.
Ms. Edina?
Thank you very much.
Hello, Ms. Edina.
Thank you very much.